Hi guys, welcome to my YouTube channel. Today we are going to be talking about the calcaneus bone. But before we continue, don't forget to like and share my videos and subscribe if you haven't. So let's get right into it. So this is a calcaneus bone, and this is the largest tarsal bone. And just as we have said in the video of talus, if you haven't seen it, you should go check it out. We said that there are 7 tarsal bones, 5 metatarsal bones, and 14 phalanges. So the calcaneus is the largest tarsal bone, and this bone forms the heel of the leg. So the heel is formed by the calcaneus bone. Side determination of the calcaneus bone. To determine which side this calcaneus bone is, that it is determine whether it is for the left or whether it is for the right, we use the following features. So, and the anterior surface is small and the posterior surface is large. So you can tell the difference between the two. This is small and this is large, right? So this is my posterior, this is my anterior. Posterior is large, anterior is small. The lateral surface is flat, while the medial surface bears this protrusion known as the sustentaculum tali. Then the superior surface or the dorsal surface has this convex facet, and the inferior surface is triangular. The inferior surface or the plantar surface, that is the part you place on the ground, is triangular. So I come again. Anterior surface is small, posterior is large, lateral surface is smooth, medial bears this protrusion called the sustentaculum tali. Superior surface bears this convex facet, while the inferior surface is triangular. Superior surface is also known as dorsal surface, and the inferior surface is also known as plantar surface. The plantar surface is the part that is placed on the ground, and this part is one that forms the heel. So with all the things we've said, we can finally conclude that if this place is directed medially and this place is directed laterally, this place is upward, this place is upward, this place is downward, and this is posterior. So this is my posterior, this is my anterior. We can conclude that this is a left calcaneus bone. So this is medial, the midline, this is lateral, away from the midline, posterior, anterior, superior, inferior. So this is the left calcaneus bone. So the features of the calcaneus bone: the anterior surface is the smallest part of the bone and has a facet that articulates with the cuboid bone. So this part of the anterior surface articulates with the lateral cuboid bone, that lateralmost bone that is in the distal rule. So this facet articulates with the cuboid bone. The posterior surface is divided into 3 areas: the upper, the middle, and the lower. This upper part is smooth and the other ones are rough. So we can see that this part is smoother than this part. Now for the superior surface, it's divided into 3 parts also. We have the most posterior parts, and this part is rough. We have the middle part, which has this convex facet, and this convex facet is also called posterior facet, and it articulates with the facet on the inferior surface of the body of talus. So if this is the talus bone, this is the inferior surface, and this is the facet on the inferior surface. So it articulates with it in this manner. So we can see it. So the posterior facet articulates with this inferior facet of the talus bone, right, forming the subtalar joint. The plantar of the inferior surface is triangular and has 3 tubercles: the lateral, the medial, and the anterior. So this will be the anterior tubercle, because this is the part that is directed anteriorly. So this is the anterior tubercle, then this is the medial tubercle, and this is the lateral tubercle. How do we know? The lateral surface is flat and the medial surface has this protrusion that we call the sustentaculum tali. So we know that this one that is directed towards the flat surface is the lateral tubercle, and this one that is directed towards the sustentaculum tali is the medial tubercle, and this is the anterior tubercle. The lateral surface is flat and rough, so we can see that it is not smooth, but it is almost flat. It's not completely flat. There's still some elevation on it, but it is not completely flat. Then the medial surface is concave. You can see that there is like a depression in this area, so it is not protruding outward but protruding inward, so it is concave. And in the upper part of the medial surface, there is this protrusion that we have been mentioning, and this is the sustentaculum tali. So on the sustentacular tali in the upper part, there is a facet that partake in the formation of the talo-calcaneal-navicular joint, this area here. Then below the sustentacular tali, we can see this grooved area, this depression. Can we see it? The grooved area? Yes, exactly here. So this part, it provides passage for flexor hallucis longus, the tendon of flexor hallucis longus. So this area can be painted in your exam, and you can be asked that, okay, what structure is related or what structure passes through this area? It is the tendon of flexor hallucis longus. So those are the features of the calcaneus bone. So the attachment on the calcaneus bone, you can see I've painted some areas on the bone. So this is just to let us know the area of what is attaching to that area. So starting from here, we have attaching to the middle part of the posterior surface is the tendocalcaneus and the plantaris. So the plantaris is somewhere around here, and the tendocalcaneus is here. So that is what is attaching there. So coming to the, this is the medial surface. Why? Because of this tentaculum tali. Coming to the medial surface, we have this structure here, and this is the medial head of the flexor digitorum accessorius, also called quadratus plantae. So medial head of flexor digitorum accessorius. Attached to this area is a ligament, the deltoid ligament. This blue area is the deltoid ligament. Then relating to this groove, like we said before, is the tendon of flexor hallucis longus. So the question can be in two form. They can just ask that, okay, what structure is related to the area painted? That is your flexor hallucis longus, right? But if they ask what structure is attached to the area painted, then that is your deltoid ligament. Then going inferiorly, or the plantar surface here, so we know we have the anterior tubercle, the medial tubercle, and the lateral tubercle. On the anterior tubercle, we have the short plantar ligament. Between the three tubercles, we have the long plantar ligament. So this is the short plantar ligament, and this is the long plantar ligament. Then on the medial tubercle, we have in this area the plantar aponeurosis. So here is plantar aponeurosis. Here we have the adductor hallucis, abductor hallucis, plantar aponeurosis, abductor hallucis. Then this one, we have this flexor digitorum brevis, flexor digitorum brevis, and we have the adductor digiti minimi. So I'll come again: abductor hallucis, flexor digitorum brevis, and adductor digiti minimi. These three muscles, they form the muscles of the first layer of the sole of the foot. So adductor hallucis, flexor digitorum brevis, and abductor digiti minimi, they form the layer, the muscle of the first layer of the sole of the foot. So on the lateral surface, we have the lateral head of the flexor, this one here, lateral head of the flexor digitorum accessorius, also called quadratus plantae. So here is the medial head, here is the lateral head. Then on the lateral surface, we have this groove and this depression. So this depression here, there's a depression there, the area that I painted is called peroneal trochlea. This depression here is called peroneal trochlea. This area is a groove for peroneus longus, and this area is a groove for peroneus brevis. So this is the peroneal trochlea. Within the peroneal trochlea, this depression is the inferior peroneal retinaculum. So here is inferior peroneal retinaculum, but this is the calcaneal fibular ligament. Posteriorly, calcaneofibular ligament is just 1 centimeter behind this peroneal trochlea. Then this is, it gives attachment for the inferior peroneal retinaculum. Don't forget, this is the lateral head of the flexor digitorum accessorius, medial head of the flexor digitorum accessorius, short plantar ligament, long plantar ligament, plantar aponeurosis, abductor hallucis, abductor digiti minimi, and flexor digitorum brevis. These three muscles form the muscle of the first layer of the sole of the foot. Then we said here is the deltoid ligament. Then relating to this area, that's the sustentaculum tali, the structure that relating to the lower part of the sustentaculum tali is a flexor hallucis longus tendon, or tendon of the flexor hallucis longus. So attaching to this area is the extensor digitorum brevis here at extensor digitorum brevis. Remember we called the sulcus calcanea in the talus video. So if you've not seen it, go and check it out. On the talus bone, we have the sulcus tali, and when they articulate together, they form an opening. So this is sulcus tali, this black area in the talus bone, sulcus tali, sulcus calcanei, and together this all they form an opening known as the sinus tarsi, and both of them give attachment for the interosseous talocalcaneal ligament that is from the talus bone to the calcaneus bone. And this opening is called the sinus tarsi, formed by the close approximation of the sulcus tali and the sulcus calcanei coming together. So that's that. So a quick recap on the attachment. We have extensor digitorum brevis here, and we have the interosseous talocalcaneal ligament here. So we have the inferior peroneal retinaculum in the peroneal trochlea, and 1 centimeter behind the peroneal trochlea, we have the calcaneofibular ligament. Then below that peroneal trochlea, we have the groove for peroneus longus, and above it, we have the groove for peroneus brevis. Then also on that lateral part, in the lower part, we have the head, the attachment for the lateral head of the quadratus plantae, also as flexor digitorum accessorius. Then on the inferior part, we have the short plantar ligament on the anterior tubercle, the long plantar ligament in between the three tubercles. Then on the lateral tubercle, we have the abductor digiti minimi. We have on the medial tubercle plantar aponeurosis, this place here, and we have abductor hallucis, this place here. Then in between the abductor hallucis and abductor digiti minimi, we have the flexor digitorum brevis, and these three muscles, they form the muscle of the first layer of the sole of the foot. Then in this place, we have the deltoid ligament, then relating to the groove or the structure passing through the groove below the sustentaculum tali. This groove is known as, the structure is called the flexor, tendon of flexor hallucis longus. Then on the posterior surface, the middle part, we have the attachment for tendocalcaneus and plantaris just around this place. And that is all for the attachment on the calcaneus bone. The ossification center for this bone, it has two ossification centers, one primary ossification center and one secondary ossification center. So the primary ossification center appears in the third month of intrauterine life, that's third month, and the secondary appears in between. It can come from 6 months, it can come 8 months. So it's between the 6th to the 8th month of intrauterine life, and it finally fuses by the 14th to the 16th year. So that's that. Much for watching. Do not forget to like, share, and subscribe to my channel. Bye.